In the series of Let's Know COVID-19 Better, we will try and understand why India, being the world's largest manufacturer of vaccines, is facing acute shortage of vaccines for its own citizens. I am Adeline Bhana Minch and we have the story for you coming up. The question we are trying to answer today is why world's largest manufacturer and exporter of vaccine is facing acute shortage of vaccines for its own citizens. Here's the story.
Across states in India, we hear the same mantra of there being a lack of vaccines. States like Maharashtra and Odisha had to turn away people due to shortage of vaccines.
No doubt. Administrating of vaccines to India's 1.39 billion people was always going to pose a challenge. But better planning of procurement and deployment of vaccines could have helped alleviate the problem to a great extent.
Another reason was the untimely exporting of vaccines to other countries. The government of India started the Vaccine Maitri program at the exact time as there was vaccine drive domestically. In total, 66 million doses were exported, while India's entire vaccine program from mid-January to mid-April provided 130 million doses. This meant that India exported a month's supply of vaccines that it is now in dire need of.
India's vaccine policy was also another reason. India was extremely cautious about allowing new vaccines into the country.
India denied approval of Sputnik V in February 2021, citing Dr. Reddy's failure to provide immunogenicity data. Similarly, Pfizer was forced to withdraw its emergency approval application because the government insisted on a local bridging study. While it is important for the regulatory authorities in India to monitor vaccines which come into the country, the bureaucratic process could have been relaxed given that adequate clinical trials were done for these vaccines abroad and also considering the escalation of the pandemic situation in India. Covishield and Covaxins were approved despite of its inefficient data on their efficacy.
Lastly, a lack of foresight by the government has also led to the situation we are currently in. In October last year, when the first wave of coronavirus was towards its end, the government had still not placed order for the vaccines nor had started funding to the manufacturer of vaccines when the health experts indicated a second wave was imminent.
11 million doses of Covishield and 5.5 million doses of Covaxin were finally ordered in January 2021. In March 2021, as the second wave was starting, India finally placed its first big order of vaccines. 100 million doses of Covishield and 20 million doses of Covaxin.
1.5 lakh doses of Sputnik V vaccines have arrived in India and will be available to the public by the second quarter of the year. Hence, lack of planning and procurement, untimely export of the vaccine, and lack of foresight are some of the reasons which have contributed to the situation we find ourselves in. We need to course correct as soon as possible by addressing to these issues. Hopefully, before the third wave of coronavirus hits us, we should have a significant part of our population vaccinated. This was all we have for you today. Stay tuned for more stories on the pandemic. Stay safe, get vaccinated.